it is not accessible. It is not right in their community. So it's very difficult for them. So who is to make the care? Who is to make this care? Who is to make the care accessible and affordable? The meaningful individuals, you and I, can make the treatment to be accessible and affordable. As individuals, as families, we can make it to be affordable and accessible. We have, like in a family, you can't just leave when your person is diagnosed of having cancer, or your friend, you cannot just leave the person. When I had my treatment, I can boldly say that my siblings every month have what each person, they agree. Each person say, okay, I can give this, I can give it, I can comfortably give this every month. And I did not ask for help from anywhere. And I comfortably, in fact, I can tell you that I was richer when I was doing my treatment than even when I was not sick. So what am I saying? Individuals and families can come together and help their person. Don't neglect your person and say, oh, is a death sentence. We don't want to spend our money on a devourer cause, a devourer cause. It's not like that. Then we have communities. Communities can come together and be able to, when you go for New Yam Festival, what are you doing for your community people that are suffering from cancer? What do you want them to benefit? This is a platform where you can raise awareness and where you can raise funds for them. It's not just the merriment of the day, but to be able to sustain people and to help people in the community that are suffering from cancers. Then we have NGOs like Pink Africa. I can confidently tell you that they are doing well and they are going places. They have not even started. They are doing well. I know when my sister came down with cancer, breast cancer, Dr. Annie called me when she knew and asked me, how can we be of help to your sister? And I said, no, let's help other people. I know that my people can take care of her. She called me and asked that. And I know she has been doing, they have been sending patients to us, and patients have been benefiting from it. But they are churches, we will go to mosque and speak on their platform. In fact, as I'm telling you, as at that second week of July, the Bishop of Calabar Anglican Diocese has given us go ahead to come to all the Anglican churches to come and speak to people. And we are yet to we are talking to other pastors to go there like that. Then survivor groups. Survivor groups matters a lot because we can pull help for other people suffering from cancer. If God has helped us and we are surviving, then we should be able to talk to other people to be able to help. And I know people have been helping us. I know people are coming out to help us, even as individuals, as survivors. Even if it's 1 naira you have, you can give it. I know what's happened in one of the days that somebody came for chemo. Even somebody that, one of our nurses, that the daughter was even on chemo seat, had to pay. She just brought out money and gave me. I said, for what now? She said, for that patient. I was touched. I've seen, there are people on this platform that I appreciate them so much that when they come for their treatment, I don't want to mention their names here. One of them is late now, of blessed memory, but Others are still living. When they come for their treatment, they look out for other people. Even if it is food, they buy for the other person. When they notice that, why are you not drinking water? Why are you not eating? They ask that question and they give. They even give money. Some of them have paid for other people's chemo. And it is this survivor group that can pull help from everywhere, because decisions cannot be taken outside the group. And that, in my language, they say you cannot cut off somebody's head in absentia. So in whatever we do, survivors must be part of what we do so that they can pull the program up. Then financial institutions, all these financial institutions where we bank, we can collaborate with them. When we do carnival every year, what is their contribution to help cancer patients? And we have companies that we can talk to and be of help. We have drug companies, we have like these people that we use their products, blood giving set, water for injection, normal saline. What is their contribution to care of patients? We should be able to assess and pay them. This is part of their community responsibility, giving back to the community. Then we have social organizations. Social organizations can be a platform where we raise funds for people to get accessible treatment. Then we have the government. The government in all should be able to help us. And there are people that will say, oh, this government is not for cancer because cancer is a death sentence. No, cancer is not a death sentence. And that's why we ask our survivors to come out so that they can see them and see that, oh, people are still living even after cancer treatment, and not just living, thriving and doing well. Driving and doing well. I can tell you, I'm a good testimony of thriving after cancer. This is 10 years, and I know what good things I've done, even after cancer diagnosis. Then we have caring beyond, because we know that cancer care should not be out of pocket. That's why we're emphasizing on where we can get help. Then caring beyond medicine. Then comprehensive patient support, psychological counseling, emotional support, because depression is real in cancer treatment. We should be able to psychologically put our people to be balanced. Emotional support from the home, from the hospital, from health workers, from the communities they belong to, from everybody around us, even co-workers. Survivorship programs. This is supposed to go a long way in helping our patients to thrive even after diagnosis and treatment. Nutritional guidance, as we will listen to on our program today, rehabilitation services for people that have been away from their jobs,
Hello,
for
ma.
people that
Nurse
have so much
Bookie, you
side
have 2 more
effects that
minutes,
it
please.
will take them time to adjust back to the
Ma, you have 2
community
more
and back to
minutes,
work.
please.
We should look at rehabilitation services and palliative care. Palliative care starts from the beginning of the care, and palliative care includes pain management. You are not complaining too much when you are saying you have this, you have that, this pain and that, but you should be properly managed and not put yourself on drugs that can be so toxic to your body and so dangerous when you combine them together. I want to say that in all this, if we put ourselves together and work together from this year, let's look forward and know that we can have affordable and accessible treatment and care. Like I was saying, there are some families that started hospitals in rural areas that the health workers, specialist health workers, might not even be able to access. When you want to do this kind of program, to start a program, to start an hospital or whatever it is, please seek counsel. talk to the government, talk to the parastatal you can join hands with, so that all can work well and it can be centrally placed. In conclusion, we realize that a stitch in time saves many more and not just 9 stitches. We all have a responsibility in making cancer care affordable and accessible, because no patient should have to choose between life-saving treatment and meeting basic family needs. Also, affordable healthcare improves both individual well-being and national development. I thank you for listening, and I hope you stay till the end of the program. Let's listen to other presenters. Thank you.